demonstration now of preparations of a relatively simple veneer case, one of the ones we did in the Bonded Functional Aesthetic prototype DVD that hopefully you've had a chance to view. We built up the composite a little bit onto the soft tissue to demonstrate to the patient what it would look like if we did a little tissue recontouring. And so we're just marking the tissue with a diode laser. It happens to be a Navigator laser from Ivoclar. How we're going to sculpt the tissue, really only about 1/2 millimeter. All right, now we're going to go ahead and do our depth cuts here. And this becomes very simple if we know we're going to end up, if we've done this essentially 3D smile design. I'll get out a depth cutting burr based on the color change. We need about 2 color changes, so we need 2 shades color change, about a 5 to 6/10 of a millimeter thick veneer. So I get out a 5/10 depth cutter from Brasseler. It's an LVS1. And you can see me pass along, and the middle third and the incisal third, I'm really not cutting the gingival third. I'm being very careful that I don't cut the papillas. If you're passing from one tooth to the next, it can be easy to dig into the papilla a little bit, so I'm very careful about that. So I'm really only using the middle and incisal third. I might go back and pass a little bit in the gingival third, but I'm going to end up tapering the veneer down to the gingival margin. Then I'll use something like an LVS4, LVS3, could use a KS1 to do a depth cut, about a millimeter 0.4 in the incisal edge. Typically I can work with about 1.5 millimeters thickness at the incisal edge to create the effects I want. So I'm going along and actually using, I believe, a KS1 here, which is 1.2 millimeters, and doing a depth cut just a little bit thicker than the thickness of the burr. Then I'll use a pencil or some sort of marking device to mark the depths of those depth cuts. And then we're going to come back and remove all the material between those depth cuts. I happen to like the burrs developed by Ron Goldstein. This is LVS4. LVS3. You can use an LVS4, which is a little bit smaller. It's mostly coarse with a little bit of a fine tip, so you can start your margin. I'm using obviously a little bit of water here. We're cutting through this special composite down to the depth cuts or the pencil marks. Make sure that you adequately reduce in the line angles. And since we're preparing all 6 teeth, we can go into the interproximal area just a little bit here. If I was only doing one tooth and stopping, let's say at the lateral incisor, I'd be very careful that I didn't adjust to the natural tooth that I wasn't going to restore. All right, and we take that same burr and we do our gross reduction here to our depth cuts. And what you'll see very quickly here is that we haven't even prepped all the way through the composite. With older techniques, we would have just arbitrarily cut into the teeth and probably end up removing too much tooth structure. Now we're going to go ahead and just scale off the material, and your etch pattern was based on the time that this was going to be in the mouth. We talked about in the previous DVD. I just did a relatively small spot etch so that I can quickly pop off the rest of the material here. And you can see that we have really done very little tooth structure removal, if any. I probably could have gone right ahead and did this even without the mock-up. But I wanted her to wear this for a while to get one aesthetic acceptance, but also to functional aesthetic acceptance to the new length. All right, now we're going to go ahead and remove the rest of the material, bonding agent, a little composite that's still stuck to the tooth. I'm cutting a little bit dry there, really because of the video. We were having a little bit of a problem with light getting, water getting on the camera. So I'm just removing the remnants of the composite at this point. We let a little composite go over onto the lingual here just for mechanical grab. She'd also had a previous bonding to close that interproximal space that we're going to go ahead and remove, and that was done dentist prior to me. I try and scale it off first if I can. If it doesn't relatively easily scale off, then we're going to go ahead and remove it. Since I'm going to prepare teeth already, since we're in a preparation situation here, I like to have a finish line. If it was a no prep veneer, obviously we wouldn't put any finish line, and we need a very thin veneer, especially at the gingival area. There's not a major color shift at the gingival area. I like a fine diamond to put the little finish line on. I use an 8876 from Brasseler. If I was using maybe a Serac technique or a D4D technique, different type of material that I might machine, I would use a different type burr, one with a little bit more of a rounded end for let's say, a heavier chamfer, like an 8856 012. And I'm just going along and putting a little light chamfer finish line on that, and toward the distal right there. We're not widening the tooth. We're going to narrow the tooth just a little bit there. So I'm going to remove a little bit more tooth structure on the distal line angle of that central incisor. Now, if you've noticed, I haven't packed any cord at this point. There's a reason for that. I want the margin of my veneer to be at or slightly supragingival if possible. Interproximal, since we're going to have to close space, we need to go slightly subgingival, and we'll do that after we pack cord. Again, since we're preparing, I'm taking that burr you just saw a second ago at the distal incisal line angle so that I could round that over a little bit, or distal incisal edge, excuse me. And we're coming along and doing really the same thing we did on tooth number 8, on number 9, now on number 8, putting a light finish line. Now I'm going to round into various regions here. I'm taking on the incisal edge here, and I'm just smoothing the incisal edge. We'll go into the lateral incisor now, and since there's a little bit of an undercut there and we're going to widen the lateral, the goal is to widen the lateral, the finish line needs to go toward the lingual transitional line angle. So I'm doing what's classically called a slice preparation right there. And now we'll put just a light finish line on the lateral incisor, and you can see that I've already done that little bit of tissue sculpting that I previously marked with the diode laser. And at the facial incisal edge, like I talked about in the lecture, I like to have a rounded facial incisal line angle. And what you just saw me do previously a few seconds ago was just round that facial incisal line angle. We'll smooth that a little bit later with a disc. I'm going into that so-called elbow region, the gingival proximal region, to hide the margin in there a little bit. There was a little discoloration on the canine, and so I'm just prepping just a little bit in that region, again without packing cord at this point. And then we'll move over to the other lateral and do the same thing. And you can see that we don't have as big of space to close there, but I still move that finish line slightly to the palate. So we have a little running room to start that porcelain a little bit more lingually to be able to close off the space. Now we'll go ahead and finish the other canine, and just again put a light chamfer in there. We've got plenty of space. You saw from the bonded functional aesthetic prototype that we have at least 6 to 7/10 probably facially, and we've got that really without preparing teeth at all. Go up to the incisal edge and put just a slight finish line on the lingual. Now we're really almost done at this point. Now we're going to smooth or tie in surfaces, the incisal to the proximal and the incisal to the facial. I like the Softflex discs from 3M. They make them in 2 thicknesses. This is the thicker one. I like this one because it's a little bit more flexible, and you can see I used the dark blue one in just rounding the facial incisal line angle. Now we're really almost done. We're really only a few minutes into the procedure, and we're about ready to get ready to make an impression. Well, I'm going to go ahead and do some sort of tissue retraction. I still like cord. There are other techniques, certainly lasers, Exposil, things like that, that I'll use on the right type of case. But if we're doing multiple teeth, I still like cord. I'm going to put 000 into the sulcus, and this is before I finish the margin. And I'm not going to drop the margin down anymore. When I come back to finish this, I know where I need my margin line now. Since we had a moderate diastema there to close after we removed the bonding, I used 2 separate pieces of cord. If these teeth were well juxtaposed or good interproximal contact, I would have just used 1 long piece of cord. All right, now I'm just going back along and finishing any area that I see that maybe I had a somewhat corrugated margin where I wanted a nice, smooth, even margin to follow the finish line. I want to make the job easy for the laboratory ceramist if I'm going to go ahead and prepare, which we are in this case. And now with the cord packed, we can drop our margin subgingival in the interproximal region so we can close this diastema. As you can see, we took the finish line toward the palate, and we'll drop the margin just a little bit subgingival so we can start the porcelain there. We round the mesiofacial line angle. Here are the finished preparations, actually after the impression, and you can see a very smooth and even transition between the surfaces. Here is the finished case, just to show you the 6 veneers after